Hello everyone, my name is Zaki. I will talk about an article. The title is The Sensitivity and Specificity of a New Scoring System Using High Resolution Computed Tomography to Diagnose Lung Cancer. Lung cancer that originated from bronchial epithelium. This disease is one of the most common causes of death among malignancies throughout the world. Diagnosis of lung cancer is confirmed by histopathological findings from specimens collected from biopsy. Unfortunately, biopsy is not always possible for very small tumors or tumors located in unreachable areas. In other cases, patients may be too severely ill or refuse the invasive procedures like bronchoscopy, biopsy, or surgery. On the other hand, a high-resolution chest CT technique can accurately reveal the morphology and anatomy of lung abnormalities. Lung cancer has become a major health problem in Indonesia. It has been a challenge to manage because it is often misdiagnosed as tuberculosis, with delaying referral and proper treatment. The diagnosis of lung cancer requires pathological confirmation, histology or cytology. An alternative method to diagnose lung cancer accurately is urgently required in cases where histopathological examination cannot be performed. The chest CT with HRCT technique can predict this malignancy. The aim of this study is to develop an HRCT scoring system that can predict lung cancer as accurately as histopathological analysis. Method: perform a cross-sectional study on 55 patients aged 23 to 80 years, comprised of 40 male and 15 female patients suspected of having lung cancer. Patients underwent HRCT with and without contrast and CT-guided transthoracic needle aspiration or TTNA to obtain cytological specimen at Cipto Mangunkusumo General Hospital, Jakarta from December 2006 until March 2008. All cytological specimens were then analyzed in the Department of Pathological Anatomy, Faculty of Medicine, University of Indonesia. The items evaluated from the CT films were volume of the tumor, HU, spicula, ground glass opacity classification, pleural tail, regular node sign, angiogram sign, cavity atelectasis, infiltrate, bone destruction, pleural fluid, metastasis, and the engrailment of the lymph node. Other diagnostic methods for lung cancer included histological samplings of sputum, bronchoscopy, pleural puncture, and lymph node biopsy, and were performed by attending pulmonologists. Procedure: the CT machine used was somatum sensation made by Siemens, which can perform the HRCT technique specifically for lung CT scan with or without contrast with 120 kV and 90 MAS. The CT-guided transthoracic biopsy or TTB was done in all patients to obtain cytological specimens that were sent to Department of Pathological Anatomy, Faculty of Medicine, University of Indonesia for analysis. In the main abnormality group, special measurement in this research is volume, different from previous literature where measurement was based on the biggest diameter on one side only. Volume of the tumor mass was measured manually because the HRCT multi-slice for device could not automatically measure the volume. HU attenuation was determined before and after contrast administration at the most dense area. The HU difference was counted before and after contrast administration in the same location. Data of volume and HU in the continuous form was made categorical of practical reasons, which reserve Operating characteristic or ROC analysis. The crossing point was determined by considering optimal sensitivity and specificity. Other diagnostic tests such as bronchoscopy, biopsy, bronchial lavage, bronchial brushing, or needle aspiration of bronchial mass or intrathoracic tumor or transbronchial lung aspiration or TBLB were performed. Cytological or histological specimens were analyzed at Department of Pathological Anatomy, Faculty of Medicine, University of Indonesia. Next, results. In 43 patients, malignant cells were found. Adenocarcinoma was identified in 13 patients, squamous cell carcinoma in 8 patients, and only 2 cases of small cell carcinomas. No large cell carcinomas were identified in this study. There were 16 patients with non-small cell lung carcinomas. This tumor cannot be categorized into adenocarcinomas, large cell carcinomas, or squamous cell carcinomas, since the cytological results were not specific. In 12 patients, malignant cells were not found. However, this did not rule out of the possibility of malignancy. There were 7 cases in which the origin of the tumor could not be determined, and only 4 patients with tuberculosis and 1 unidentifiable teratoma. Patients with tuberculosis and teratoma could not be excluded from the study, since in the chest X-ray, the nodules were suspected as lung cancer. Tuberculosis and teratoma, or benign, were identified only through pathology. In this study, the result of HRCT in 11 patients were benign. Of 10 patients, or 19.9%, were in accordance with the pathological results as benign lesions or malignant cells not found, but only 1 patient showed malignant cells. Whereas in the other 44 patients, HRCT showed malignancy. There was concordance between pathology and HRCT in 42 patients, or 95.5%, and only 2 patients showed benign results. The conclusions. This new method to diagnose lung cancer is constantly as accurate as histological findings, with a sensitivity of 97.7% and specificity of 83.3% and a cutoff score of 35. Okay, according to the system, a score of less than 35 indicates that the lesions were benign, while a score higher than 35 is suggestive malignant. Okay, that's all of my presentation. Thank you.